Medicare Advantage, navigating the playing field. Stay tuned for more information how your team can not only hit a home run, but can score and win the game with Medicare Advantage. In a previous blog, we discussed contracting with Medicare Advantage plans. It's imperative that your agency understand any contracts that you establish are the best contracts for your organization and your patients. Now that you have contracted with a Medicare Advantage plan, you've arrived at first base. You are now going to look at and review the very significant details within your contract to ensure success with that contract. Understanding, are you contracted with an HMO, a PPO? What type of plans are included in that contract? You also need to understand, specific to your organization, what code sets are going to be utilized in HCPCS codes, what disciplines you are allowed to utilize, whether registered nurses and therapists, or if your organization is also contracted for the use of assistants. If assistants are allowed, such as PTAs, is there a different code set for registered therapists versus assistants? You also need to understand supplies. In many cases, non-routine supplies are not reimbursed separately from the visit or episodic payment. It is very important that you understand, if it's an episodic payer, the supplies should be listed on the claim, even if additional reimbursement will not be received. As we've now passed first base and turning towards second, arriving at second base would mean that we have been thoroughly through all of the provider manuals. We have now registered with the websites. We know who our contact people are. We have reviewed the detail of the manual to understand every intricate piece that must be mastered in order for you to be successful in contracting with this plan. Please make sure you are clear that the information in the provider manuals and any updates that are provided by the payer will trump your contract. So in other words, what is in the actual manuals, any updates to the manuals, any updates that this payer puts out, makes an announcement about, puts in their newsletters, will all take precedence over the information in your contract. So you need to ensure that you have registered so that you receive those email updates, so that you get notifications when updates take place, and that you participate in any educational offerings such as webinars. The electronic portals that these Medicare Advantage plans are getting more and more familiar with are extremely important, especially when it comes to initiating authorization, checking verification of your patient's participation in their plans, and in many cases, being able to check the status of claims from a collection standpoint instead of spending hours and hours on phone calls trying to get the status of a claim. These portals are extremely important, and you need to ensure that the appropriate personnel within your organization is registered with logins and passwords to easily access these electronic portals. As we are approaching third base, we need to ensure that both intake and authorization in our day-to-day process is basically as perfect as it can possibly be. At the point of intake, you need to make sure that your intake staff fully understand exactly which plans your organization does accept, whether contracted or not, and that they are not simply looking at Medicare Advantage organizations, but the actual details of the plans. As patient referrals come in and you've established that the payer is acceptable, there needs to be Medicare eligibility verifications run on your patients immediately. When there is access to portals, etc., to verify that the patient truly is enrolled or continues to be enrolled in these plans, That process should take place at the point of intake, not a week down the road, only to discover that the patient actually has a different payer than what we thought to begin with. Intake is a very critical point at which we must establish exactly who the payer is and all of the specific criteria surrounding the eligibility of this patient to receive payment from that payer. As we move on to the authorization process, in obtaining authorization from these payers, you need to ensure exactly what their process is. In some cases, you can initiate authorization in the portal and then possibly have to speak with someone later. There is a submission of clinical documentation in many cases. Who within your organization is responsible for reviewing that clinical documentation to ensure that it is appropriate for the payer and will do everything it needs in order to obtain the authorization required. You also need to ensure that there is a day-to-day process in place to make no mistake with recertification or reauthorization requests. When the visits are about to expire under the initial authorization, what is the process for obtaining new authorization or extended authorizations for your patient? In establishing that authorization, there are 5 rights in obtaining an authorization. You need to ensure that your authorization has met all 5. Right agency, right NPI number, right patient, right services and codes, and right dates of service. The authorization process or the lack of an authorization is the absolute #1 reason for a rejected or denied claim. Please ensure that the authorization process within your organization is spotless. As we have rounded third base and we're headed home, we need to look specifically at claims filing and collections, a very critical component of ensuring that you are reimbursed what you expected to reimburse when you first contracted with this benefit plan. Payer setup in your EMR system is the most critical piece of ensuring that your claims are filed to the extent that the payer will consider it a clean claim, and preferably the first time you file that claim. With payer setup, there are some very critical components that must be identified and ensured that you have appropriately set those up in your EMR system to ensure that clean claim. Ensuring you have the correct plan and the address that it should be sent to. Ensuring that you understand the authorization requirements. Will they be required on the claim or not? The appropriate claim format. Is it a UB04 form or a 1500 form that the payer is going to require? Are you required to have a HIPS code on the claim? The answer is yes, if it's a Medicare Advantage plan, whether it's per visit or whether it is episodic. Timely filing requirements. Another #1 denial reason for some of these claims is you not getting the claim filed with the payer in a timely manner. You need to ensure you understand fully what that is and have that appropriately set up in the system to flag in the process. Collections is huge. You have to ensure that your collections team is on top of any rejected claims, any denied claims, and that those are immediately reviewed, identifying what the issue is, correcting that issue, and refiling the claim so that, again, if you're in a timely filing situation, the rejection or denied claim is not going to prevent you from being within those timely filing guidelines. The follow-up on these claims, again, can be handled in the portal. In some cases, you have to make phone calls, but it is imperative that it is very timely and that someone is consistently and daily, honestly, working those rejections and denials. Healthcare Provider Solutions would be thrilled to assist your agency in winning the game with Medicare Advantage and any managed care plans. Please call us today to find out how we can assist you in not only obtaining contracts, but implementing those contracts and again, winning the game of Medicare Advantage.